All right, I want to give you some insight into testing that we do in the office. So I was brought in on a case, personal injury case, previous accident, some complicating factors, and basically I needed to prove the patient's injuries and severity of the injuries. So I did what's called a dynamic EMG of the neck. So here, these are electrodes. I placed them at certain areas of the spine. So it's basically like an EKG for the neck, and we can do this in the low back too. So think EKG in the heart, you figure out what's going on with the heart. This is the same thing, except we are doing it with the spinal muscles. So on the right side, this is the normal, okay? And then this is our injured patient on the left side. And as you can see, range of motion greatly diminished. She has about half the normal range of motion as she should. And this red dotted line here, this represents the right side of the neck muscles, so here. And then this blue line represents the left side. Okay, so we place those electrodes, it gives us the information, and then we measure that in microvolts. Same thing, except for we do them with these muscles around the front, so left and right side, same thing. Red dotted line, that's the patient's right side. Blue that is the left side. And then we also measure range of motion with these wireless devices. Okay, so we're going to skip some of this test and go into where she is really, really bad. So normal, this is when a patient flexes to the side. So we should see this nice separation of both of these muscles. Now over here, you can see that left side is abnormal, right side is normal. You can see that she is highly abnormal within these. She's got what is called muscle guarding. This is the body's natural response to pain. So when a patient does this motion, both muscles fire when they should be not firing at the same time. So this is highly abnormal. And then it correlates highly with injury within the neck. Same thing here. This is normal. This is our patient, and this is highly abnormal. Let's check. This is when a patient turns their head. So this is called rotation. So we do it both sides. That's normal. And this is abnormal. You see how the muscles basically fire together. This is very painful for the patient. Highly, highly abnormal. So with this testing, I can clearly state that the patient is injured, and here are the problems, on rotation, on bending their neck to the one side, and the other side is highly abnormal. So we get a good clinical picture. That way, in my treatment protocol, I know, hey, I need to do these certain things, work on these certain motions. That's just some of the testing that we do in the office. Then we can correlate this with x-ray findings and really pinpoint and nail down somebody's symptoms and help them have a life in full motion.